What's up, guys? Today we're going to go over measures of center and variation. So this is in the research section. I know you guys hate research, but this is not a super hard one. I'm going to kind of explain how this would show up on the board, so because the ways that it shows up can kind of be a little bit tricky. So let's get into it. Pretty simple definitions. I feel like we've talked about this in elementary school of mean, median, and mode, and what does it mean? I'll kind of go through a quick example, and then we'll kind of talk about the sample question and a little bit of the statistics that comes into play when we're looking at these data values. Now, again, we're using these numbers to kind of understand different types of research that could show up. So, like the average age for a person who has onset of arthritis is this age. The median number would be like, okay, of the people in the population, the median age would be like the middle of the data set. So that would be like, let's say like 60 or something like that is when they start having knee pain, just throwing out random numbers. And then mode would be the amount of numbers that occurs most frequently. So let's say that of the data set, you have like 25 individuals in this set of 100 that all happen to be 58 years old. So we'll kind of talk about this. I'll break it down a little bit more, but the mean is going to be the average. So if we're thinking like the average age of somebody who has arthritis is this age, that's what that is. Median would be the middle part of the data set. So I'll kind of show you how that looks. And this is good if there's outliers, because let's say that somebody had some traumatic onset at like 25 and all of a sudden they have arthritis. Okay, well, that's an outlier. That's going to kind of throw things off. And then let's say that there's somebody who was doing really, really, really good and their arthritis didn't cause them pain until they were like 80. Okay, so we're kind of taking out outliers so then we can use the medium amount of data to apply to interventions and to understanding different patient populations, screening techniques, outcome measures that we would use. A lot of this is definitely more heavy hitting on the PT exam versus PTA exam, but still important to know these sort of things. Then mode is the amount of numbers that shows up most frequently. So like we'd most expect to see somebody with this condition being this age. So let's kind of just pull out a data set of numbers here. So let's say that we have, just for the sake of this, again, in an actual research setting, you would need at least 30 individuals to do a t-test to make it like a valid test of a patient population, but we're just going to use like 10 numbers for an example. So let's say that we have, okay, we just surveyed 10 people who have arthritis and we asked them, what age did you start feeling pain? Okay, so let's do like that outlier where we have that like say we have that 22-year-old, and then we have 38-year-old, then we have a 50-year-old, then we have 55, 58, 58, 58, then we have a 60. Let's just do 67 just for funsies. What are we at? 1, 2, 3, 4, 5, 6, 7, 8. We need 9, 10. We need two more. Let's say they're 68. And then let's say that we have that 80-year-old. Okay. So I just was giving you your set of numbers here. We have a set of 10 numbers. So again, here are all of our numbers of our individuals who said we started having arthritis at this age. What we would do in order to find the average is we would add up all of these numbers and divide it by 10. So I'll do that for you guys right now, and then you won't have to worry about it. All right, guys, so don't worry, I did the math for you. So if we're trying to find the average, wow, I can't spell. Wow, that's embarrassing. Average. If we want to find the average, we would add up all these numbers, which that equals 554, and then we would divide that by 10, which means we're just moving the decimal place over. So the average age of onset for arthritis pain for this made up population that I've created was 55.4. Now you might think like, but most of those numbers there said it's 58. Well, let's just see how other data points give us a more accurate measure of, okay, when are we starting to see these people having this pain? Because I see 55 starting with arthritis pain. I'm like, I feel like that might be a little too young, at least for me, with the patient population I see, but you never know. Could that actually be a good representation? We're not sure, but that's really close to this number here, which is on the lower end of our data set here. So we look at our median number. That's the number in the middle of the set of data. So again, if I was counting things up, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, so our middle point would be right between 5 and 6. So ideally, let's say that this was like, if this was 56 and this was 58, then our median data point, we would say that there technically isn't a median, but let's just say for the sake of this argument that our median number is also going to be our 58. Okay? So we see that we're like, okay, well, that's also the number that happens to appear the most often, which is also 58 because we have 1, 2, 3 58. So if we look at this data point, because we have this outlier all the way over here at 22, we also have this outlier over here at 80, using that median number actually gets us a more accurate representation of the patient population that we're trying to treat with this. So a lot of times if there's an outlier, that's why we would use a median data point for this set. Now, if I really wanted to be 100% accurate, I would have added another number in here to give us a true middle point, but makes sense based off of this. 55.4 seems a little bit young. 58 seems like that's more an accurate representation of this patient population based off the amount of people that we see with this arthritis pain onset, and then also the median age of this data point. So that's how you would use that data and actually find the mean median mode. And then we have another version of this, which is called measures of variation. So we have percentile, which be X amount of numbers of fall above or below this number. So we would say the top 10% of those individuals scored better than 90% of the individuals. So if we look at this and we're seeing like a data point, we and say, okay, the patient is in the, top 25%. That means that they are better than three-quarters of the population at whatever we're scoring them on. If they're in the bottom, 10%, that means 90% of the individuals scored better. Okay. So that's kind of the big thing. That's what a percentile means. I feel like we're pretty familiar with this. If you've ever done like a race or something like that, you know where you're looking to see where you fall. Quartile means we're splitting it up into the bottom fourth, then the top half and bottom half at 50%, which is the middle point again of our average of our data. And then 75% would be our upper quartile. So at 75%, 75 to 100% is that next quartile up of like the top 25% of scorers. Range would be between two numbers. So again, if we're seeing like most people who have the arthritis pain have it onset between 55 and 65. Cool. Awesome. Just throwing out numbers out there. That's what that means. So again, scores range from a 45% to an 85%, stuff like that. Standard deviation, this is where it gets a little confusing. So if you're like, Brie, this has been easy so far. Let me explain what this means. Standard deviation is based off of, I believe it's off of some Z-scores, I want to say, which is a measure that's in statistics. Again, this is a little bit confusing. If you're not familiar with statistics, you're like, I've never experienced this before. Let's just talk about this. So standard deviation is the spread of the data based off the norms of the population. So the biggest thing we end up using this for is actually for osteoporosis. We see this very commonly. So osteoporosis, as you can see over here, would mean this is like the bottom, like 2.5% of the population. So again, if we're looking at this bone density right here at the middle at 0, this would be the average bone density of the population. Take a bunch of people, do a bunch of DEXA scans, see what the average is. Okay. One standard deviation below the mean will consume of 32.5% of the population, basically below the median point or the middle point, which is at 0. So we're getting a little bit lower. Now, again, this is on a bell curve. So a bell curve will have the majority of the people in that middle section. So we can see that like the majority of the population, we're what, like 65% falls between one standard deviation plus or minus out of the mean. So again, 65% of the population falling there. Wow, that was a bad number. 65% of the population falling there means that most of our people end up average. Makes sense. When we have pathological problems, this is where people are way outside of the mean. So we can see osteopenia over here is like this bottom 15% of the population that falls between 1 to minus 2.5 standard deviations below the mean. So what does that mean? That means these people are way outside of the norms. Like they have very low bone density, which is shown here. This is also a really good example of seeing the difference between osteopenia and osteoporosis. Osteopenia, you see there's a lot of people with this condition. They're just a little bit below normal. So we have like our norm amount of like 65% of the population is doing really good here. Lower than that, So about 15% of the population, not our bottom 2.5%, but a little bit higher than that, we're still seeing pathological problems because we're seeing that decrease in bone density. But they have taken the average across the population, spread all the data out on a bell curve, and they said, these people, they're lower than one standard deviation outside of the mean. Okay, so that means they have osteopenia. Okay, cool. We can see clearly that there's a good portion of the population that has this, but it's not as bad as the portion of the population who has osteoporosis. You might think, oh my gosh, this seems like I feel like every old lady I see has osteoporosis. Well, not all of them have osteoporosis. Sometimes they don't understand that they actually have osteopenia. It's not as bad as they think. But if we also think about it, if we look at all the women across the population, there's a lot of women who are younger who are doing a lot of strength training who are up here in this like top percents. Like I don't want to brag or anything, but your girl is in the top like 2.5% for bone density because I lift a lot, okay? So we have people who are in the top percent, but we also have people who are in the bottom percent. This is just a bell curve that spreads all of it out so you can see most people end up in the average area. So if you're like, Bree, I'm just lost, here's what you need to know. Osteopenia is between 1 to 2.5 standard deviations below the mean, not as severe as osteoporosis, but we can see how that data point shows that they're not doing good compared to the regular population. Osteoporosis is a very serious thing, which very high chance of bone density breaking because that's the people in the bottom 2% of the population for bone density. So less than 2.5 standard deviations below the mean. And when I say that, that just means like you're not doing well. You're way below average. So hopefully that makes sense, at least that last bit that I explained to you, because that is what tends to happen when we see people pop up with our, you know, pathological situations. So our sample question here, a clinic owner is reviewing patient satisfaction surveys and scores from the past month to determine which measure best represents the quote typical patient experience. Most patients rated the clinic between 8 to 10 out of 10, but one patient gave it a score of a 1 out of 10 after a scheduling dispute unrelated to treatment quality. Which measure of central tendencies would best represent the typical patient satisfaction score in this situation? One says mean, two says median, three says mode, and four says range. So I'll give you guys a second to think about this. All right, guys. So the answer is going to be median. That's the kind of similar to that situation I showed you earlier where we have that one outlier. If you see the word outlier, that is our key word, okay? So we have our one patient who scored a 1.1 out of 10. I think we can all think of a patient that like randomly got really pissed off because they were like, "Why don't you have the times that I want?" Or like they show up at the wrong time and they get all pissed. Like I've had patients like that showed me pictures of their cats. We had a great time on the first visit and we did really well. And then all of a sudden, my boss messages me and says, this patient gave a 1 out of 10 on their survey. I'm like, bro, I don't know. I don't know. And sometimes people, they give that 1 out of 10 because they think that, like, they got the scale backwards. It's like that one meme of the girl where they're just like, I'm not gonna get into it. Anyways, yep, so the answer here would be median because if they took the mean, they would have all these patients who are doing well, then that 1 out of 10 would drag the average down and say, oh, looks like the average rating for this clinic's like a 6.5 or a 7 out of 10. But you see most people are rating it between an 8 to 10. So if they use the median data, we're probably getting about like an 8.5, 9 out of 10 for the satisfaction rating, which is a more accurate representation of the uh, patient satisfaction survey in this situation. Mode, well, that would be great. With the situation with an outlier, you always want to be picking the median option. And then range is unrelated. That's not a measure of central tendency. We just needed a fourth option. All right, guys, a little bit of a confusing topic for some parts of this, but pretty simple for others. Don't overthink it. You guys got this. I will see you guys in the next one. Take care.